Well, let's say that here in the United States, we are all at risk of cardiovascular disease. There is about 16 million people currently hypertensive. And high blood pressure, which is your blood pressure going up a little bit, and it starts even in early childhood, is one of your major factors that will bring you into a cardiovascular risk. And overall, for all of us, 1 out of 4 people will die from heart disease. So that's why it's important to understand our cardiovascular risk and how can we protect ourselves from dying from heart disease. Let's say that is extremely important. If you go by and you talk to anybody who will tell you, hey, are you hypertensive? No, I'm not, I'm young. But about your mom and dad or your grandparents? There is about an 80% chance that when you are in your early adulthood or above 40, you're going to develop hypertension. So family history is fundamental, plus what you are. Well, before going to the warning signs, let's say that what put you at risk to having a heart problem, which is what's going to make you come to the hospital, like a heart attack, chest pain, or a stroke. The factors that put you at risk don't have any signs. And let's start with hypertension. You can be an early hypertensive patient or even a full-blown hypertensive with very high blood pressure, and you won't have any symptoms. But in the meantime, your body is getting damaged, all your vessels, and every single day that you go by with high blood pressure, the risk into your kidneys, your heart, and your brain will increase. So what we want is people to understand that the final point of coming to a hospital with a heart attack is not a correct moment to do intervention for your heart disease. We better learn what's happening earlier when you don't feel anything. You said if family history is important, yes, because genetics mold us. But more than the genetic part of cardiovascular disease is your risk factors. I explain who you are in terms of what you eat, what you do, whether you drink or smoke or you do drugs. Who you are as a person has an impact of more of 80% of your risk. Meaning that whether you eat well, whether you do workout, whether you smoke or drink, all that, no matter how many medications you eat or how many times you go to the doctor, what you are as a person, and with all the risks that you're carrying in your life, is what's going to impact your life. And is going to eventually give you heart disease or stroke or renal failure. And it's hard for patients to understand because they say, can you give me a pill for high blood pressure? Can you give me a pill for cholesterol? Can you give me hey, why don't you do a bypass and fix my heart? We can do that, but the risk that will bring you to an end point in death is your habits or what you do in your life. Well, in terms of who's going to die from heart disease, there's no difference. We all, men and women, we are at the same risk of heart disease. And the mortality rate for men and women in the United States is the same. So we're the first cause of death and we all die. Let me explain. Some people are scared about cancer, HIV, and all these weird diseases, but they don't kill as much as a stroke, heart disease, renal disease. So when I mention the organs, what I'm telling you is that the vessels is what is part of the cardiovascular system. So when your vessels, your arteries, your veins are damaged, your kidney is damaged, your heart is damaged, your brain is damaged. As I say before, your habits. So early in childhood, sadly, we have to go back when we're children. If you learn to eat, if you eat less salt, if you eat more vegetables, if you take care of yourself, meaning don't drink, and drink moderate, don't smoke, don't do drugs, workout. I mean, if you spend 3/4 of your day sitting under, on a desk and you don't do exercise, all those things together, which is part of your life, is what is going to impact your. Let me put it this way: an obese person, okay, or not so obese, a little bit overweight, just losing 1 or 2% of their weight will impact their cardiovascular risk and their death risk, okay? Let's say that now you're sick. You're a sick person. There are different signs for alerting yourself and the family around you. Let me explain. When you're sick, sometimes you don't know what to do, but the person around you will know. So for example, with heart, when you are in the risk of a heart attack, one of the manifestation of that is chest pain. But the people doesn't understand that it's not a pain. It can be a pressure, it can be a weight on your chest, and it can be like a stabbing pain, and it goes down from your throat, your jaw, to your arms and your chest, or any point of those that will present into your life immediately, and there's a sensation that also you could have shortness of breath, is an immediate call to 911. Not to the family member to ask what's going on. No, you call 911 because they need to rule out a heart attack, which is eventually one of a major cause of death.